fair to say that nobody really disputes the fact that the more testing you do, the stronger position you are in? Do you have any insights into why we haven't ramped it up yet on anything like the scale that other countries have managed?
Well, there's been a decision, if you recall, on March the 12th, when Prime Minister Johnson and his two advisors came online. They said they were now moving from contain to delay phase, and that meant that they were going to stop community testing and shift the testing simply to hospitals and health workers, because they said in a more intense phase of the epidemic, you couldn't do contact tracing. The trouble is that assumes, and I think the mathematical modelers have assumed, we're all in the same epidemic. And of course we're not. I'm talking to you from the East Riding of Yorkshire, where transmission here is pretty low, whereas we've clearly got hotspots in London and the West Midlands. But I just want to say, look, what we're trying to do is to suppress transmission of this epidemic as quickly as possible, and then to get our economy going again, so we haven't got mass unemployment and all the rest. And I would argue, and many other public health people would argue, that mass testing in communities, as well as the national lockdown for social distancing, which is a blunt instrument, to be honest, mass testing combined with that is the best way to go.
Just
now, why
us
test?
Yes.
Why? So, the first rule of epidemic control, as the WHO would say, is test, test, test. And the reason is, first you want to identify someone who is a case, who's got the infection. Immediately you want to trace all or as many of the contacts they've had as possible, and then you quarantine all of them. So in Korea, for example, where they have set up mass testing and suppressed the epidemic and are now releasing lockdown, they would go and find a positive case. They would give the person an app on their phone. They ask them to send in their symptoms twice a day so that they could monitor if they're deteriorating. But they could also, through geolocation of their phone, monitor that they're staying in quarantine.
Yes.
And that has worked very well there. They've done 410,000 tests. We're doing, I think at the moment, about 5,000 patients a day and a total of 7,000 tests. So that's the first thing. Chris Whitty is right that in hotspot areas, you go easy on the contact tracing. You still quarantine people if you can, but you must protect your health workers. So you need testing for that. But then we need to know the pattern of infection and where the virus is all over the country, so that where it's relatively low intensity, and the last data we saw suggested that 50 local health authorities have fewer than 10 confirmed cases. Now, clearly it's much more than that because we're not doing the testing, but we need to know the low intensity areas. But the most important thing of all, and I'll stop, is to have a system where once you've ramped it all up, you can then control loosening the lockdown. So, in all the Asian countries and hopefully in Germany, they get suppression of the epidemic within about 6 to 8 weeks. And even in Wuhan, which was really out of control, a bit like London, they're already loosening up now. But they've got a system to monitor where the outbreaks are and jump on them very quickly. And that means that maybe you'll be isolating 10% of the population, but 90% can get back to work. So that's why I think it is so important.
Yeah, they can get back to work because they've had it and recovered.
No, because they may be immune. They may have had it.
Right, I see. Yes.
If we've got the virus transmission right down, and we're still continuing to do testing of anybody that has some dodgy symptoms, and we've got an effective quarantine, we know that we can keep this locked down. Now, if we don't do that mass testing, we have to go back to a national lockdown.